Welcome back to Diabetic Foot Files, the podcast where we explore the fascinating, frustrating, and often misunderstood world of diabetic foot care. So, today's episode, we're going to talk about a medication that has been around for decades. I've talked about it a little bit, but this episode is dedicated to this medication. And, it gets prescribed almost every day, but yet it's misunderstood by some providers. And we're going to talk about Nystatin. I love me some Nystatin. But more specifically, we're asking an important question. Why does Nystatin work wonders for some fungal infections and completely fail for some others? And if you ever prescribe Nystatin powder for a foot rash, right? Recommending it for the moisture in between the toes and encountered a patient that said, I've been using this antifungal for months and nothing's happening. This episode could be very helpful. And also why I had a period, I think like maybe 2 years back, I kept on prescribing the statin and my patients kept on coming back saying, oh, the pharmacy kept on saying they're out of it, or they would like these outrageous prices of like $70 for Nystatin. So we'll talk about that as well because there wasn't a statin shortage, okay? So the word nystatin is actually quite interesting and from one of my favorite states in the world. So the discovery of nystatin, because everybody knows I love me some history, the story begins in the 1950s. Before modern antifungal medications, fungal infections were very notorious to treat. They were very difficult to treat. And two researchers from the New York State Department of Health, Dr. Elizabeth Lee Hazen and Dr. Rachel Fuller Brown, discovered a compound produced by a soil bacterium. And this compound showed remarkable activity against fungal organisms. And they named it Nystatin. Why did they name it Nystatin? So in order of the New York Knicks, it was because they were combining NY, New York, okay, and statin is for stops fungal growth, statin, okay? So they would combine it and they named it nystatin, and that is super cool. It became the first safe antifungal medication widely available for human use. So what exactly is nystatin? So nystatin belongs to a family called polyene, okay? Polyene antifungals. And other relatives would be amphotericin B, natamycin, and they target particular fungal species called Candida species. So this includes Candida albicans, Candida glabrata, Candida tropicalis, and these organisms behave very differently from fungi responsible for classic athlete's foot. Now, nystatin, how it works. So think of fungal cells like a water balloon, and the balloon membrane contains a molecule called ergosterol, Ugh, like cholesterol, but ergos- ergosterol. I'm just going to spell that out, but I always knew it was equivalent to cholesterol when they were explaining it in class. So Ergosterol. I know I'm not pronouncing it right, but forgive me. Like I said, we're all not perfect. Okay, so nystatin seeks out ergosterol. Oh my gosh. Okay, forgive me. And once attached, it punches the holes in the fungal membrane, the tiny channels form, and the water rushes in, and cell contents leak out, and the fungal cell essentially explodes and dies. And this is why nystatin is considered a fungicidal, okay? Meaning that it kills fungi rather than simply slowing their growth, okay? Cytal, like homicidal, things like that. Okay, so that means it's killing instead of stopping the growth, right? So, what's a great mistake that we make as clinicians? Okay, so here's where sometimes we get in trouble. So, a patient could present with peeling skin, itching, scaling, and toe web irritation, right? And the assumption is it's fungal, and the statin is prescribed, and then weeks later, nothing improves. Why is that? Because not all fungal infections are the same, okay? There actually are different classes and families of fungi. So, athlete's foot usually isn't from the Candida species, okay? So majority of athlete's foot are usually caused by dermatophytes. Common offenders include trichophyton, rubium, trichophytum megagrophytes. I know I'm not pronouncing all this right, and epidermophyton floscosium. Okay, so I would just look that up. What the dermophytes, the common dermophytes for athlete's foot. Okay, because some of these words are very uh, big, complex, but sometimes I get tongue tied. I always tell people that. And these organisms, these dermatophytes, right? Digest keratin. They love keratin. So they love skin, nails, and hair. And that's a key point because what does nystatin have activity to? Candida. So nystatin has little to no activity against dermophytes. So let me just say it again. Nystatin has little to no activity against dermophytes. And what do dermophytes usually cause? Majority of athlete's foot, okay? Nystatin is excellent for candida. It is poor for most athlete's foot infections, unless you take a biopsy, something like that, and it comes back as the Candida, most of the time, it's caused by those 3 major dermophytes, okay? And this explains why there is treatment failure if you're using it to treat athlete's foot, okay? So, when it comes to our diabetic patients are uniquely vulnerable. Why is that? Because of the hyperglycemia. Remember, our hyperglycemia can alter our immunity, increase the moisture retention, promote microbial growth, delay the skin repair, and if you just add on to the neuropathy, possible increase in BMI, limited mobility, and suddenly toe web spacing becomes this microbial ecosystem, which is a perfect greenhouse for fungus to grow. So, can you grow candida in between your toes? Candida thrives, literally loves warm environments, moist environments, occluded environments. And the fourth web space on our feet is often a favorite spot for them. I don't know why it's just the fourth. I think mostly because, like the fifth toe usually just like clamps underneath it too and occludes it even more. That's my theory. Everybody has their theories, but science may include that white macerated tissue, burning, moist skin breakdowns, satellite lesions, and foul odor. And this is where nystatin could shine, okay? And another side note for patients, that's why we're telling you to look in between your toes. It does play a whole role because you don't know how many patients come in and they have moisture in between their toes, right? But then all of a sudden one toe starts hurting. Why is that? Because the skin broke down so much, it went to the bone, and the patient doesn't know how long they had it because they had neuropathy. So that's why it plays a huge role because then if it went to bone, most likely the bone it has an infection, aka osteomyelitis, and that requires most likely bone resection, antibiotics, or possibly an amputation. But that's why we tell you to look in between your toes, okay? Because it is quite common, very, very common, okay? So enter trigo. So one of the most common overlooked diagnosis in diabetic patients, like I said, looking in between your toes as well as your intertrigo. So this occurs when the skin surfaces rub together, especially between the toes, underneath the breast folds, groin folds, abdominal folds, okay, even in arm folds, okay, where moisture accumulates and inflammation develops and candida frequently follows. And nystatin powder may be particularly effective against this because it treats what? Candida, not dermophytes, candida. And that will keep the area nice and dry. So it kind of has a dual effect and it makes it quite useful for moisture environment management. So, why does the powder matter? Many people focus on the medication, but the delivery system actually matters, okay? There is a nystatin cream. The advantage of a nystatin cream is it's hydrating and comfortable. Disadvantages, the cream, what this cream does, it adds moisture. There is a nystatin ointment. Advantages is quite protective, but what is the disadvantage? Or ointments is quite occlusive. Now, nystatin powder, that's the one I most commonly prescribe. The advantages, what does powder do, right? Powder loves to absorb moisture, right? So it absorbs moisture, it reduces friction, and the nystatin powder itself targets candida. So for those macerated toe web spaces, right? Powder can make more sense than cream. Don't use cream in between your toes. That's just no. Just don't, okay? Delivery system is off. I love some gentle violet in between the toes as well, but I would let the physician apply it because, like I said, I've had incidents where patients put it on their toenails. Yes, it's an antifungal, but then your toenails are stained, and then, it's a, you know, it's not too pleasant to look at. So, and it stains almost everything. But rubbing alcohol gets it out. That's what I've noticed for me, okay? So, let's ask before choosing a treatment, we have to ask, what organism am I treating? Especially if we suspect foot fungus, right? Question is this a dermatophyte? Is this Candida? Is this bacterial or is this a mix? Okay. And many diabetic foot infections involve multiple organisms simultaneously. Very notorious for being polymicrobial because the diabetic foot is a big ecosystem because of the vulnerability that diabetes cause. Okay. So when it comes to fungal infections can coexist with Staphylococcus aureus. Staphylococcus just a series of itself, Streptococcus, and even gram-negative bacteria. Who else loves moisture? Pseudomonas, okay, making the diagnosis quite challenging. So let's do a quick clinical case. A 62-year-old patient with diabetes presents with fourth web interspace, maceration, burning sensation, moist skin, and mild odor. The statin was prescribed and started 2 weeks later. Significant improvement. Why? Because it was candida that was contributing. Okay. Now, and see, that's a very important reason to follow up as well. Okay. Because if they didn't do like a biopsy or something like that, and it didn't work, patient we wouldn't know, okay? And then it just keep on worsening and then be like, "Oh, this isn't candida, it probably might be a dermatophyte," okay? So now consider another patient who has dry scaling, plantar peeling, and chronic itching, and nystatin was prescribed. Nystatin failed because cultures later identified that it is Trichophyton rubrium. So it was the wrong organism, the wrong drug, and expected failure because nystatin has little to no activity to dermophytes, okay? So we have to be able to distinguish and know what type of fungal species we're targeting when we see it on a patient's foot. Now, moisture is the real enemy, but moisture also helps with wounds. It's just life is a balance, okay? But one lesson repeatedly appears in diabetic feet that moisture thrives or drives pathology, okay? Because excessive moisture, oh my gosh, we already know Pseudomonas loves it, Candida loves it, bacterial loves it, okay? Insects love it even. Skin breaks down and secondary ulceration does occur. So the goal is simply not to kill fungi, it also is to restore the healthy microenvironment on the patient's skin. So when it comes to prevention, that's why we say look in between your toes. Make sure in between your toes are dry. After you take a shower, okay? Check in between your toes. Check your feet. Daily foot inspections. You got to look for whiteness, maceration, cracks, drainage. Sock selection plays a huge role. Choose moisture wicking materials. Avoid constantly damp socks. Footwear rotations. Allow your shoes to dry completely because this is a quite hot summer. There are heat waves. I'm trying my best to stay inside, okay? I would sit in front of the AC if I could. Lower glucose levels actually reduces fungal susceptibility. So I want patients to understand how much glycemic control plays a huge role in the whole cascade of helping your body get that balance of homeostasis and decreasing your susceptibility as well as vulnerability to infections. And then early treatment. If you're checking your feet every day, you will go to your podiatrist if something is a little off. I would hope so. Never self-treat at home. I don't like that, okay? Because it always ends up needing more because more delay means more treatment, okay? So, if you see something early on your feet, go to the doctor immediately because the earlier we could treat it, the better the treatment and less skin breakdown that develops, okay? So we have to think about that. So what are the future directions of the statin? You have to remember the foot is its own microbiome. Future diagnosis may allow us to identify the fungal species more rapidly at a point instead of guessing or treating blindly or repeated failure with the wrong medication. Oh, another thing, right? So remember I talked about a statin shortage. There was. And at first I was just like, why is this keep on happening? Like, okay. But While Nystatin itself has not always appeared on official nationwide FDA shortage list, right? Several manufacturers have discontinued or reduced a certain nystatin formulations. And in 2025, at least one major nystatin topical powder product was officially listed as being discontinued as available supply. So it was a shortage, like my patients were telling me the truth. And I had to find an alternative for my patients. So what experience patients had at the pharmacy was not it often is not a true national shortage, but it was a distributor shortage, regional stock outages, manufacturer discontinuation, back order, and increased seasonal demand during hot and humid weather when fungal infections do increase. And I did have that during the summer, okay? So keep that in mind because also, like I said, if a pharmacy did have it, it would be extremely expensive. My patient would be like, "I didn't get it because it was, like, $70." I'm like, "What? How is that how is it that expensive?" Okay? But now it makes sense, okay? But we do have alternatives, okay? And sometimes, nystatin is not a preferred formulary care. So some patients might even face prior authorizations, higher copays, and full cash prices. Okay. So we have to keep that in mind when we're prescribing these things for our patients. Okay. So what do we do? If if it's not available, okay? Alternatives, I always tell my patients the best alternative for me, what I prescribe for my patients is miconazole powder. You can get that over the counter. That's quite easy. It's a broad spectrum antifungal over the counter. It's less than $10. It's good for interdigital fungal infections. Clotrimazole powder. I love some Zeazorb AF. So it's called Zeazorb AF. It absorbs moisture and it also contains miconazole, sulfonate powder. That is more better for the dermatophytes, okay? Less effective when it comes to Candida, but those are the alternatives, okay? So when it comes down to it, I want patients to understand that, whenever something is wrong, the doctors, we help, hopefully we know the answer, okay? Hopefully we can help people understand it. But the clinical pearl is if it presents, right? If your foot comes with like white, soggy web interspaces, maceration, odor, burning, right? Everybody thinks sometimes just immediately bacterial, right? But sometimes the real culprit is Candida. And the treatment that could prevent the progression was sitting on the pharmacy as a back order. That's what it seemed like. But don't forget, we can have alternatives like miconazole, Zeazorb, okay? Because sometimes the battle for limb salvage starts with getting the right medication on the shelf, okay? So nystatin is neither overrated or underrated. It's quite misunderstood because some people like to just prescribe it for any fungal, but it only is used against and highly effective against Candida species. So when we use it against dermatophytes, nystatin actually does fail because it has no activity towards it. And that's the end goal that I want this episode to understand. Okay? Because the lesson for diabetic foot clinicians is simple. We don't just treat fungus, we actually identify it. We're actually foot fungus investigators. Okay. That's the big thing that we have to understand because every infection, like I always tell people, infections have personalities, wounds have personalities. They're all quite different, and we have to like fully understand it. But the only way to fully understand it is to understand the patient. And I mean, I think watching things like House and other things, you'll realize that a way that he got to a lot of diagnosis is by understanding what was going on with the patient initially and their lifestyle and everything like that. That usually was a key to a lot of the mystery diagnosis, right? So that's why it plays a huge role to get to know your patient, to understand who your patient is, what's going on in their life, their environment. Just understanding it, it helps you, it helps the patient, it makes everything easier, okay? So that we can understand what exactly am I treating. So this is Diabetic Foot Files. I hope everybody liked it. I mean, I guess this could be an episode of Wound Intelligence Wednesday, but stay curious, stay vigilant, and take care of your feet because they take care of you. And I'm Dr. G, and this is Diabetic Foot Files.